Alright, this is going to be the review video for the cardiovascular diseases. And I want to take this a minute and look at and remind us of the anatomy of the heart, because everything is always going to come back to your anatomy, okay? So as we start to look at the different diseases, I just wanted to remind you of the anatomy, okay? So when we were talking about valve or abnormalities like murmurs or mitral valve prolapse or even aortic stenosis, okay? Remember, it's the valves that open and close. So when the right atrium contracts, it pushes blood through the tricuspid valve into the right ventricle, and then but it closes back so that blood cannot go back through it. So what's happening in any type of murmur is that blood is either going back or it's leaking through. They're not closing fully. Specifically with mitral valve prolapse, because this is the oxygenated side of the heart, if it doesn't close properly, then blood is leaking through, and then it isn't being pumped. There's not enough of it being pumped through. So that is why they end up with having palpitations and things like that, and maybe even chest pain and all the things that mimic a heart attack, okay? And in aortic stenosis that we listened to the heart sounds on yesterday, you know, the aorta is the largest artery in the body, and it is responsible for delivering blood to oxygenated blood to all parts of the body. So it goes through the aortic valve, and then you've got this huge artery that branches off to go to the top of the body or the superior portion of the body, and then you've got this branch that goes around that then delivers all the blood to the inferior portion of the body. And so it should be a pliable vessel, okay? But as it gets stiff, or as it stenosis, it's going to have that sound like because if it is not able to pump correctly, then blood is not going to be going out of it as easily as it would, okay? So that's where you get those different heart sounds. Just wanted to remind us of the anatomy. All right, so get your highlighters out, and I'm going to try to help you zero in for the test. This test is going to be different from the ones that you took in the first semester, in that mostly you could just study the Quizlet and be fine. For this test, you're going to need to study the Quizlet. You're going to need to study your notes. You are also going to need to look at the strips that you have copied or that you have traced, and then you're also going to need to study your article questions, okay? If you study those things and look over them and watch this review video, then you'll be in good shape, because I know we've covered a lot of material, and this is just going to help you zero in on what you need to know for the test. It's impossible to learn everything, and as you go through your academics in medicine, you know, you will eventually learn what you need to zero in on. But as you're learning that, I wanted to make a review video to help you. So I've highlighted these things in red, what you need to know, okay? So for heart murmurs, you need to know that these are valves that don't close properly. Think about those heart sounds that we listen to, and the most common population to have a heart murmur is children. So if you hear a heart murmur, in an initial heart murmur in a 45-year-old, that's of concern, okay? If you hear a heart murmur in a child, of course we're going to want to know if this is the first time that they've had one, but they are very common in treatment. Valvular stenosis, you need to know that that is a narrowed, stiff heart valve, especially aortic stenosis, which was what we listened to on the mannequin. Okay, for mitral valve prolapse, you need to know that this is specifically the mitral valve that does not close fully, and this can cause all the same symptoms as a heart attack: palpitations, sensation of a rapid heartbeat, shortness of breath, fatigue, chest pain, okay? you absolutely need to know, so you should have written this out in your notes, and it's on the board if you haven't, that for chest pain, everyone is going to get an EKG and cardiac enzymes. That's the two tests that they are going to get. That was also in the articles that you read. You also need to know, you need to remember old cart when a patient comes in with any kind of issue. We're bringing our old cart, okay? Bring it in the room with you. You're going to ask them about the onset, the location, the duration, the characteristics, the aggravating factors, relieving factors, and any treatment that they have done. Okay, as far as diseases ending in itis, the most important thing for you to remember is that this is very specific, that it has a stabbing pain in the chest. Not a crushing pain like you'll see in a heart attack, but a stabbing pain. And the treatment for that is going to be drugs to fight infection and inflammation, and then, of course, pain meds. So myocarditis specifically is inflammation of the heart valves. And then about endocarditis, you need to know that this is the inflammation of the innermost heart lining and valves, and it is life-threatening if it's left untreated. All right, as far as heart failure goes, we talked about this a pretty good bit. What you need to know are the symptoms, okay? Specifically those first four symptoms of shortness of breath, cough, edema in the ankles, and weight gain. If you see those symptoms, you need to be thinking heart failure. And the causes, specifically someone that has had a heart attack or repeated heart attacks. These are going to be your patients that could be in heart failure. All right, remember this was our picture of that pitting edema, okay, where the body is just not, because the heart is not pumping hard enough, it's not able to send the blood through the kidneys so that the kidneys can get rid of waste and excess fluid. Okay, you also need to know the treatment for heart failure. We're going to treat that with diuretics, vasodilators, and cardiostimulatory and cardioinhibitory drugs. We want the heart to beat harder, but we need to slow it down, okay? The brain wants to speed up the heart to meet the oxygen demands, but that's not helping in heart failure. It helps in a normal heart, but it doesn't help in heart failure. So we need drugs that will slow the heart down and make the heart pump harder. So you need to know the treatment for heart failure. Okay, diseases of the arteries. All you need to know about aneurysms is what it is. It's a weakened artery that bulges and may break, and that sometimes the symptoms are none. They might have pain and swelling, but this is one of the disorders of the heart that can absolutely have no symptoms. All right, as far as coronary artery disease, you need to know that this is plaque in the arteries that causes a narrowing that hardens over time. Think about that vessel that I passed around that some of you looked at and some of you did not. It causes that narrowing that is going to harden over time. And the symptoms can be angina pectoris. You need to know that angina pectoris is chest pain. This is caused by insufficient blood supply to the heart. You need to know the definition here of ischemia, that it is a lack of blood flow. And then these are your classic symptoms of a heart attack: throat dryness, jaw pain, pain going down the left arm. You need to add in right here nausea, pallor. Pallor means they are pale. They can also be sweating, okay? So those are your classic symptoms: throat dryness, jaw pain, pain going down the left arm, nausea, pallor, and sweating. And all of that can be leading to a heart attack. However, you do need to remember that in women, sometimes that they do not have classic symptoms. Women may sometimes just show up and say, I just don't feel good. They may have had some chest pain the day before, but they don't always have those classic symptoms. So you have to listen to your patient. This is where you've got to drag your old cart in again and dig deeper into the onset, the location, the duration, the characteristics, the aggravating factors, the relieving factors, the treatment that they've tried. Okay. Okay, for a myocardial infarction, which is a heart attack, what I need you to know for this is to remember that aspirin is a treatment that can help a heart attack. This can definitely be something that's given at home or at a place of business or at Walmart or wherever, and most first aid kits have aspirin. Okay, as far as heart disease, everything is highlighted on this slide. Okay, so hypertension, super important. One of the biggest diseases that you will see in the population. Probably about 40 to 50% of people that come seeking healthcare services are going to have hypertension. Blood pressure above 140/90. Also remember what we wrote down and is on the board, that a normal blood pressure is 120/80 and pre-hypertension is 130/80. Okay, your causes there, you need to know those, but you definitely need to know that it is a silent killer, that it has no symptoms. That's what makes it so dangerous. Our treatment is a healthy diet and exercise and blood pressure medication. Please remember that a healthy diet and exercise take time. If you have a patient that needs to lose 30 pounds, they can't lose 30 pounds overnight. We need to get that blood pressure down overnight though. So the most important part of teaching is that they take that blood pressure medication as ordered. Okay, as far as peripheral vascular disease, the causes that I need you to know are that this does have a genetic component and that African Americans are at greater risk. For stroke, definitely need to know, remember all three of these things. I added a picture since we did this about what facial drooping looks like. You need to know that a stroke is essentially a heart attack of the brain. It's a blockage of blood flow to the brain. Ischemic stroke is a clot. Hemorrhagic stroke is where a blood vessel has burst, and a transient ischemic attack is a mini stroke. Okay, remember the acronym FAST that's on the back of the board. Facial drooping, arm weakness, slurred speech, time to call 911. That's very important. Make sure that you know that acronym. Okay, as far as your cardiac arrhythmias, I have not highlighted anything here because essentially you need to know all of this that has to do with cardiac arrhythmias. Be able to identify your strips. So look back through that other video if you need help. I'll post it on Schoology, and just make sure that you know your arrhythmias and what those are. Okay, so study for your test over the weekend, and we will review on Monday. Also do some more hands-on skills, and I will see you then. Hope you guys enjoy the snow.